Hi, I'm Eunice. I'm a climate scientist at the University of Bristol and the Cabot Institute for the Environment. I'm interested in extreme weather events, in a climate that's warming around the world. And I'm particularly interested in heat waves, and also looking at how heat waves might change in the future and the climate change, and also what the impacts of heat waves are on human health, including health outcomes like human mortality, and how that might also change in the future, and what it means to be able to adapt to these changes and to become more resilient as a society.
Hi, well, I'm Richard Morris. Was until September professor in medical statistics at the University of Bristol, based in the Department of Population Health Sciences. I have always been interested in epidemiology during my career and the effect of various exposures in the environment on human health. And in more recent years, I've looked at the effect of cold weather, especially in the UK. I've read with some interest Eunice's paper that was in the Science Reports in 2019 to do with the impact in 15 American cities of heat waves. And if I understand, Eunice, you were trying to compare future scenarios based on modelling you'd done over data from the past 20 years in those cities.
Yeah.
And you were thinking of comparing a scenario where the mean temperature rise by 2100 was 3 degrees compared with if it was 2 degrees or 1.5 degrees. I was interested to know what made you focus on those choices and what was your reasoning there?
Yeah, thanks for reading my paper.
Great.
Thank you. Yeah, I basically compared the 3 different scenarios. So a 1.5 degree warming, a 2 degree warming, and a 3 degrees warming. All of these are warmings above pre-industrial levels. And because the 1.5 and the 2 degree scenarios are the temperature targets set in the Paris Agreement, so that's these targets have they are set in the Paris Agreement, and a lot of nations, nearly all of the nations in the world, have signed up to the Paris Agreement, trying to work towards limiting global warming to these levels. So it will be is particularly useful to compare the extreme weather impacts in terms of heat wave in this paper between these 2 scenarios, what it means, like what these 2 scenarios mean in terms of future heat waves and their impact on human health in the United States in my paper. I also looked at the 3 degree scenario because, especially at the time, so countries need to submit their nationally determined contributions, which basically states what they pledge to do to mitigate and adapt to climate change, and they submit this to the United Nations Framework Convention on Climate Change every 5 years. And the first set of NDCs actually indicates that there's a likelihood that the world will warm by 3 degrees Celsius above pre-industrial levels instead. So there's this gap between what these Paris agreements aim to do and also what are the pledges within the Paris agreements that might lead to. And I was comparing these 3 levels to look at kind of the gap in impact, human health impact, between the pledges at the time and also the goals in the Paris Agreement. These have now slightly changed. So in 2020/2021, countries, some of them updated or submitted new targets. So this could have been changed as well. But I think what I see in the latest reports is that there's still a gap between what we're aiming to do and what the policies are, pledging to do.
And you've sort of drawn out the consequences that would have for the number of people who might be expected to die in such events under the different scenarios. And Am I right in thinking you've sort of tried to emphasize the gains? Because in epidemiology, I'm used to us always being terribly pessimistic, saying such and such a thing in the environment doubles or triples the risk of some form of cancer, but rarely do we think of what we could gain in policy terms. Did I read it right, that was you were trying to take a different tack?
Yeah, I think I did. I think there were two reasons that I used the 3-degree scenario as the baseline, and I compared what might be the number of lives that we could be saving from extreme heat waves if we limited global warming to lower levels like 1.5 and 2 degrees. There were two reasons I did that. One was that, at the time, the trajectory that we were heading toward at the end of the century was 3 degrees, as indicated by the first NDCs. And secondly, I think, yeah, it is always more optimistic and motivating, maybe, if you look at what would be the benefits of doing something, of mitigating climate change. And indeed, I found that, up to, I think, 2,700 deaths in an extremely hot year, could be saved in New York City, for example. And that's the higher end of our estimates, because New York City is very populated. But, hundreds to thousands of deaths could be avoided if we limited global warming. And I think that's a more powerful message than saying these many people will die if we don't do anything. I think there's value in giving a motivational message. It's exactly the same numbers. Is how you look at it.
But there's that difference of 2,700. I know you said that was at the upper end of your estimates, but was that if we managed to achieve 2 degrees or 1.5 degrees compared with the 3 degree?
That was 1.5 degrees compared to 3 degrees. So the more we limit global warming, the better in terms of heat waves and the heat-related mortality outcome. But obviously, there's also many other things, associated with the climate and weather and the environment. And I know that while I look at heat waves, you look at cold weather and how that impacts health.
On the whole, there's a graded relationship with cold, and it seems that in most countries in the world, certainly in the United Kingdom, the minimum mortality seems to happen not at your average temperature for the year, but somewhat above that, perhaps like a warmish day in summer seems to be the best for us as human beings. And as you go colder than that, gradually as you get colder, the increased number of deaths builds up gradually, and especially at the extreme of cold weather. And in some ways, at the moment, I would say in the United Kingdom, cold kills more people than heat does by quite a long chalk. That might change, the balance might change. But one of the things I'm quite interested in, and I think it's a gap in the literature so far, is what happens if we adapt. Does that mean it isn't quite so bad for extreme heat? It isn't quite so bad for us because we acclimatize either through societal change or maybe even our human physiology. But if so, does that mean we're more vulnerable to cold even more than we are already? And that's a sort of gap that I think needs to be kept an eye on.
I've thought a lot about this because there are papers in the literature that looks at climate change and what it means in temperature-related mortality. I think a lot of them, to be fair, project an increase in the heat-related deaths. And for some places, they're using the same kind of epidemiological model, but looking at the cold side, they project fewer cold-related deaths.
Eunice, one thing that occurs to me, I mean, both you and I, in our different ways, we sort of major very much on quantitative estimates of numbers of deaths. I wonder what I sometimes wonder is whether giving an estimate like, say, in New York City, there'd be 2,700 deaths avoided by the sort of heat wave, events, if one met the 1.5 degree compared with the 3 degree scenario. Do you think that is a good way to impact on policymakers? I mean, what do we know about how the results of our studies can focus for those thinking about policy in the future and their motivations for putting in place things that will help us achieve that only 1.5 degree rise?
Yeah, well, I think it's a great question. I think personally, and I think it probably applies to policymakers, is that when I look at, I think it's easier to forget what's, 0.5 degree or 1 degree difference means if we just look at the general climate and the number of heat waves every year without actually doing the calculation all the way to the impact on our human lives and our daily lives. But I think when we talk about climate and health, so we bring the health impacts into the whole picture, then it's easier to relate to, because we can all remember, we can all probably remember, if we're old enough, the 2003 heat wave being extremely hot, and a lot of people in the whole of Europe were affected.
Yes.
So we have personal experience of these kind of things, and when we give numbers of, well, then these are the numbers of lives that could be saved if we do something, or these are the number of lives that unfortunately might be lost if we don't do anything. It's easier to relate to, rather than saying there are projected to be more heat waves in the future. I think one of the things we saw from COVID was that, when you're dealing with one crisis in a country, if something else happened, then, you're a lot less prepared. Your healthcare system is a lot less prepared for anything else. And so if two kind of hazards happen at the same time, then there's a bigger risk in terms of what impacts it might have on the society.
Yes, I think that there is possibly some emerging evidence. There's that the sum of COVID and extreme heat last summer possibly added up to more than the sum of their parts, which were bad enough in themselves. But one of the things, I'm not sure whether you've been able to look at this in your own work, but I think your department is interested in vulnerable subgroups. And you just mentioned COVID a minute ago, and I think as the last year has gone by, we've become increasingly aware that although COVID does affect everybody, the vulnerable groups get, perhaps those in more socioeconomically deprived circumstances, are more likely to be affected and get bad episodes of the disease, and perhaps, in many cases, die as well. And that could also work with climate change, I think.
Oh, yeah, definitely. These are just numbers that come to my head. That in 2020, there were, I think, more than 2,500 excess deaths only over heatwave days in 2020 across England. And over 2,200 of those 2,500 was from the over 65 age group. So you can see like a large proportion, nearly every year, I think, of heatwave deaths come from the oldest age group that Public Health England look at. So this is a real concern for climate change for a couple of reasons. First of all, under warming climates, it's projected that there will be an increased number and frequency in heat waves. So these things might happen more often. And also that it's quite likely that the population is aging. As a whole, the society might just be more vulnerable if we don't do more adaptation and make the society more resilient. But of course, as you mentioned about COVID, and one of the things that really came out was that different ethnicities and people of different backgrounds are impacted differently. And I would think this would apply also to health impacts of climate change, because if there's health inequality, then these vulnerable groups are likely to be more vulnerable than other groups to other hazards and exposures as well.
Your work was about 15 American cities, probably with some of them different climates from each other. But how do you think the impact is in less, perhaps lower income countries? Is there any work to quantify that? Is the toll going to be more, relatively speaking, or perhaps, I don't know if there's any information on that. I know it's sometimes hard to get as good data, perhaps, because high income countries, of course, got the resources.
Yeah, exactly. It's, a lot of the heat and health studies that have been done in the literature have looked at developed nations, because you can only have robust modeling and numbers if you have enough health and also temperature data that's long enough, go back maybe at least more than a decade, and you have to have the daily variation in these numbers. So you have to have a good record, and many of the developing nations don't have these data. So it's a lot harder to quantify what might happen in developing nations in terms of heat health. But what I've looked at, even with, so I've looked at the United States and I've looked at Bristol as well, is that even within the same country, these kind of temperature and mortality relationships vary a lot. And I think that has to come down to, the different population structures, whether the populations are adapted to their climate and changes and the general climates of the city. I think that's why we need to focus on local scale studies and maybe work with local governments, because then you can have projections and policies that are suitable for that place and for the population structure of a certain place.
Well, sounds like we've got plenty of things to think about.
Yeah, and not just temperatures, right? You mentioned like precipitation. That was what you looked at it for South Africa and pneumonia.
In some ways, that particular data set turned out to be more focused on the effect of drought. But extreme precipitation, of course, could cause quite a number of emergencies. We know even in America what happens when a hurricane occurs. And
we actually did some work on hurricanes and looking at storm surge as well, again comparing the 1.5 and 2 degrees agreement targets. And we had the luck to collaborate with universities in Jamaica, and a few of us went there for a conference and met the local students and the university, and they're great. It's just a great country. I remember one principal of one of the universities there presenting her own experience of a hurricane season that happened in the past few years, and she presented pictures that she took, the aftermath of those hurricanes on her campuses, and these are campuses spread out in a few islands in the Caribbean. And I remember seeing a picture of a computer room completely destroyed by the hurricane. It's just the roof is gone. It's a mess everywhere. And these are pictures not found from the internet. We've seen a lot of these pictures on the news and the internet as well, but these are pictures taken by this principal. And I remember her saying that she was in a meeting somewhere in the United States when this happened, and a lot of people fled the islands in the Caribbean because of the hurricanes. She was one of the few people actually going back to the islands to see what's happening, what happened to the campuses and her students. And she took a lot of these pictures. And I feel so humbled by it. And also, I remember her saying that she personally lost students and potentially staff members, and some moved away because they can't stand, the hurricane seasons coming every year and the projected increase in impacts in the future. But some just, she never saw them again. And it's just so personal, and it's just so real. It's very personal. People are being affected by extreme weather now.
it's sometimes a hard sell for probably Western governments to devote resources to vulnerable sections of the world. Somehow it's a difficult thing to do. So we've seen during COVID the aid budget drop. But another thing that I personally think could be a driver is if we're going to see big impacts of the sort that you described in Jamaica, inevitably will fuel a whole climate refugee movement. And I mean, either we have to be prepared for that, we'll have to be prepared for refugees to arrive, or we could invest in strengthening infrastructures now.
And also helping places that might not be so well funded for, building the resilience, because I think a lot about climate justice as well, and this whole problem of climate change was and is basically driven or is here because of development and industrialization in the more developed nations. So the least developed nations actually contributed the least to this problem, but they are facing the consequences of it, and they might not be as prepared for the future consequences. And I think it's only right, in my opinion, to see this problem as a worldwide problem, and we only kind of win if we get through this together.